Hello, hello, and welcome to the Dr. Toomer Talks Show. I'm Dr. Toomer. I'm a family medicine community health physician and founder of Total Weight Care Institute. And I talk about all things health, wellness, and weight care related. So if you are interested in those things, subscribe to my YouTube channel and share with friends and family because right now I have over 300 videos on there with a lot of information about all sorts of things. And with my 30 years of experience, I'm very happy to say this is my 30th year in medicine, and I'm very proud of that. So, but today I want to talk about the 5 M's of metabolic control. And the reason why I want to talk about the 5 M's of metabolic control is because one, putting it into a nice succinct number makes it easy to remember. But the other is, it is the cornerstone of our health. We talk about all the end things: heart disease, hypertension, blindness, cancer, liver disease, kidney disease, when really the primary, when we go to the cause, the absolute cause of what is happening, it all starts from somewhere. And one of the most common threads amongst all these things, apart from our genetics, is metabolic health. So if you're interested in metabolic health, stick around. If you feel that there's somebody in your family, friends who might be interested, who might need to know about this, please share it with them, invite them to join, and let me know where you're listening from. Tell me your name, introduce yourself, and say hello. It's always nice. So I'm just going to jump right in. So the 5 M's of metabolic control. So what actually is metabolic control? Which is a good question to ask. Like I said, our metabolic status is the cornerstone of for all of our health or ill health or disease. And so managing it is the best way to get healthy. It's our body's mechanism for taking food that we eat and turning it into fuel or fat. And so if you're in a weight loss process, learning how not to make fat is very important. When you want to unmake fat, you need to learn how it's made. If you are in a heart health journey, you want to know what are the things that affect your heart in terms of your cholesterol, in terms of how your heart pumps, and all of the things that can affect your heart. And if any part of your health all comes from your body's taking food and turning it into fat or fuel. So as you can imagine, the energy that you have drives everything else. And our metabolic status is very much affected by our brain and how our brain functions. And so it's all interconnected. It's a reason why we need to look at all of these things. And so that is why I harp on metabolic health so much, and why it is so important for your health. So I just want to say hi to Jennifer. Thank you for joining from Nebraska, I'm assuming. Howdy. So thank you for joining. So why is it important to understand our metabolic status? Well, the disruption of our metabolic status, like I mentioned, is what is the cornerstone of all the issues that we have later. It's what causes all of our end organ disease. So our metabolic status essentially is how our body takes food, turns it into fat or fuel. If our body is very efficient at turning things into fat, then we have all the secondary things that cause problems with fat. So fat in and of itself is an endocrine system, meaning it gives off hormones of its own. And the other, it gives off inflammatory markers. So when you have too much fat in your body, you also have a lot of inflammation. And when you have a lot of inflammation, you have a lot of small vessel disease. And when you have small vessel disease, every single part of your body is affected. That means you're at high risk for dementia, higher risk for heart disease, higher risk for kidney failure, higher risk for infertility, higher risk for liver disease, higher risk for obesity, and a lot of other things. And so that is why it's so important to understand your metabolic status and to address anything that may be affecting that status. Okay? So, well, Jennifer, thank you for your question. I am going to do a Q&A afterwards, so I'm going to come back to your question at the end. So that's why it's so important, because it does put you at risk, especially for inflammation. But how? Why is there a disruption? Well, number one reason why we have disruption is because your genetics meets some type of a trigger. And when your genetics meets a trigger, that trigger then makes your body unable to metabolize things very well. And when it cannot metabolize things, particularly glucose, carbohydrates, our brain doesn't get the right messages, and then our brain doesn't send the right messages to the rest of the body. It doesn't tell the body the important things that need to happen, like, don't make cholesterol. 80% of our cholesterol is made from our own body. It's not just from what we've eaten. So our brain's telling our liver, make cholesterol, when it should be telling our liver not to make cholesterol. But that's what our disruption in our metabolic status does. It tells our body, take those calories, and instead of giving it to the muscle for fuel, turn it into fat cells. And that's because of our metabolic status. And so you understand how important it is to understand what your status is and how to fix it. So many of the things that can cause disruption when your genetics meets a trigger is chronic stress. Chronic stress can put you in a place where your metabolic status is no longer working like it should be, so it's disrupted. Pregnancy is another metabolic disruptor. Polycystic ovary syndrome, or PCOS, is another disruptor. Age is a disruptor, particularly menopause, or menopause, as we say. So when a man's testosterone drops, and for women when her testosterone, estrogen, and progesterone drops, then those are things that can cause our metabolic status to shift. Medications can do that. Steroid use. Certain antipsychotic medications that we use for schizophrenia can cause this. Certain biologics that we use for other inflammatory diseases can cause this. And so it's really important then to pay attention. Now, there's also something else that ties very closely to your metabolic status, and that is your cortisol. And again, cortisol is elevated with stress, and it's also unopposed with menopause. So that's why chronic stress and menopause can cause metabolic disruption. And that is why when you have metabolic disruption, now what are the signs of metabolic disruption? The most obvious sign that we have of metabolic disruption is our growth around the middle. When our waist starts to grow, no matter what we do, everything you did before suddenly stops working. You start to notice that your waist is getting bigger. That is a sign that your metabolic status is being disrupted. Another thing that happens, if you start to notice that you're getting very sleepy after you eat, that is a sign that you have metabolic disruption. If you start to notice that you're craving sweets or carbs, especially potato chips, French fries, that sort of thing, when you're under stress, that is a sign that you have metabolic disruption. And so all of these things mean that there's something you have to do to correct it. Otherwise, your body is at risk. And it's just the way it is. There's no way around it, really. And so how do you fix a metabolic disruption? So once you've determined you've got metabolic disruption, you understand the importance of what it is and why it's important to address it, and how do you fix it? So I have what I call the 5 M's. It's a method that I talk about a lot. The number one thing of the 5 M's, the M stands for MEMO method, which is my signature method, and it's MEMO. That stands for minimal effort for maximal outcome. And the reason that's so important is because when we overdo something, we tend to not sustain it and it goes away. Better to do things at a lower level for the rest of your life than to do it for a quick, intense level and then you can't sustain it and it drops off. And the reason I designed this method was because I myself had metabolic disruption to the point where my heart went into failure. I was on insulin. I was 100 pounds overweight, or more than 100 pounds overweight actually. And the only way and I had to address it. If I wanted to survive, I had to. I was given a 50% chance of living 5 years because of a heart condition. And so I had to do something. But as you can imagine, I was tired and I was overwhelmed. And the only thing I could do were little things that gave big results. And so that's what I studied for years and years on what things you can take a little bit of and it has a huge impact. And there are lots of little things that you can do that have huge impact. And then I'm going to talk about what those are. The next 4 M's are basically what those are and how you can do that in a way so you don't have to do a lot to get a lot out of it. So the first M is the method that you use. The second M is muscle. Muscle is our metabolic powerhouse in our body. It is what our body uses to reduce blood sugar, which is the component of metabolic status that tends to get disrupted and how we use it. So building muscle is the best way to maintain your metabolic status or correct your metabolic status if it's disrupted. Now, you don't have to become a gym rat in order for that to happen. Again, applying the MEMO method, minimum effort for maximum outcome. The minimal effort that you need to do to get the most out of your muscles is essentially doing squats, planks, and push-ups. That's it. And the way that I do it, and the way I've also instructed many of my clients and patients to do, is you take 30 seconds and you do squats and you rest for 30 seconds. You do squats again for another 30 seconds and you rest for 30 seconds. You do squats again for 30 seconds and you rest. That's 1.5 minutes of squats. And then you do the same thing with planks. 30-minute plank, 30 off. 30-minute plank, 30 off, 30-minute plank. Again, 1.5 minutes. That's a total of 3 minutes now. And you've already done your core and you've done your lower body. Now you do push-ups. 30 on, 30 off. 30 on, 30 off. Another 1.5 minutes. So in 4.5 to 5 minutes, you've done a full body workout. That's minimal effort for maximal outcome. And you can do that in any way that you can sustain for whatever your abilities are. So it doesn't have to be, your planks, your push-ups, your squats can all be in a way modified to what you're able to do. Now, and then the third M, so you have memo, method, muscle. The third M is mindfulness, meditation. Now, the reason mindfulness is so important is because how you speak to yourself is how your body responds. Our body cannot tell the difference between words we say to ourselves and those that are said by a bully. So it's really important to be very mindful of how you speak to yourself. Be kind, give yourself grace. And meditation helps to bring your cortisol down. So all of these things are to help your cortisol stabilize and to bring it down. And the reason it's so important to get cortisol down, like I mentioned, it is a metabolic disruptor. So we need to counter it in order to keep our metabolic status in check. One of the best exercises to do that helps with muscle and with mindfulness is Pilates. And I've repeated this over and over again, that Pilates is a wonderful way to get both your cortisol levels down and your muscle up at the same time. Also help to get your cortisol levels down. If you're unable to do it any other way, sometimes therapy works, sometimes treatment works, but the best way is if you can do something physical and mindful at the same time. The fourth M is meals. So your meals are very important, and that doesn't mean that you have to measure. It doesn't mean that you have to give up any of your favorites. But what it means is that your meals and your snacks and everything you eat should be protein forward. Most of what you eat should be protein and vegetables. And then your carbohydrates should be the least percentage of what you're eating. Doesn't have to be measured. You can just look at your plate and tell what you should eat, and that's a circle plate. Half should be vegetables, this much about protein, and then this much carbohydrates. Now, it's important not to give up carbohydrates altogether because your brain needs it to function. And like I said, your metabolic status is a neurometabolic process, and so you have to feed your brain, and your brain functions on glucose. So you still need it. And the other with meals, though, is to not drink your calories and not to drink sugar. When you drink sugar, you're basically feeding the worst part of metabolic disruption. And it's very, very hard to counter the effects of sugary drinks on your body. And so meals include sugary drinks in what you drink, and also staying hydrated. It's very important to stay hydrated. And then the fifth M is medication. There are certain things in our body that when we don't have enough of them, it disrupts our metabolic status. One of those is hormones. When our hormones start to drop, our metabolic status starts to get disrupted. And we know this because we start gaining weight, particularly through the middle. One of the signs of metabolic disruption is stomach middle weight gain. And it doesn't matter if you're overweight or not. If you're gaining in that area, your metabolic disruption is out of whack. And medication can help with that. So hormone replacement, because when our hormones are disrupted, like in menopause, our metabolic status is disrupted. When other medications, so that's hormone replacement is one of the medications that can help with our metabolic status. Antidepressant. If chronic stress and depression or other mental health illnesses are present, then treating those things are important. And so therefore, taking an antidepressant, taking your anti-anxiety, getting therapy are those things that can help maintain your status. Getting those medications. But the third that I talk about a lot, or the fourth that I talk about a lot, are GLP-1s. Low-dose GLP-1s, microdosing of GLP-1s, can be extremely beneficial for anyone who has any metabolic disruption, regardless of their BMI. BMI is the worst way of determining if someone needs metabolic correction. The percentage of body weight gain is more effective. The hip to waist ratio is more effective. In women, if your hip to waist ratio is greater than 0.85, then you have metabolic disruption. In men, if it's greater than 1, you have metabolic disruption. And so you really want to make sure that if your waist starts to grow, that's what I'm talking about. If your waist is growing, your metabolic status is being affected, and it's important to do something about it. Because your health, your long-term health, your overall health, your longevity is now in jeopardy. That includes your brain. If you want to prevent dementia, and you want to prevent heart disease, and you want to prevent kidney disease, and you want to prevent arthritis, joint pain with weight gain through the middle, then paying attention to your metabolic status is really important. And so GLP-1s help with this. And I'm just going to step on my soapbox just for a minute, mainly because I've been prescribing GLP-1s for 15 years, longer than most people have even heard of them. And as a result of that, I'm very comfortable using them in a way that helps the person regardless of what the FDA says is the criteria. We've always, as doctors, we've always used medications off-label. It was our off-label use of Victoza for weight management that gave us Saxenda, and then eventually gave us Ozempic to be used because of Wegovy, and then Mounjaro becoming Zepbound. We knew that these medications helped with weight management because they disrupted fat production. That's how they worked. They work by correcting people's metabolic disruption, and therefore reverses their fat production because of that metabolic disruption. And that's how they work. And that's why I use them, and I use them often in low doses. And so often what I hear from people is, well, it's really bad that people who need to lose like 10 to 20 pounds are taking these medicines to lose weight. Now, depending on why they gained weight and how they gained that weight, if it's from pregnancy, if it's from menopause, if it's from chronic stress, all of those reasons, regardless of their BMI, regardless of their overweight or not, their metabolic health is now in jeopardy. And if your metabolic health is in jeopardy, that means your health overall is in jeopardy. So therefore, telling people, no matter what their size, that they should not treat their metabolic disruption is unfair. And so I think of it like this. If you're someone who suffers from migraines and you need a medication to take to stop those migraines, and you know that you're going to have to take that medication for the rest of your life, would it bother you if someone used it for a really bad headache and they never had another headache again? Probably not. But because this is around weight, somehow we have this judgment of people who use medications because we see it as a weight issue, when in truth it's a metabolic status issue. And so that is why I'm so adamant about not shaming people for using GLP-1s, because there are lots of really good uses for them. Some of them you have to use for the rest of your life, and sometimes it's temporary. You just have to get people back to their baseline so that their metabolic status is not disrupting their health anymore. So, stepping off my soapbox now. So that is how you fix your metabolic status with the 5 M's. I'm going to repeat them again. Memo method, minimal effort for maximum outcome, which is my signature method. If you want to learn more about it, you can write to me at help@drtoomer.com, and we can talk about it, have a consultation if you'd like. So that's memo method, muscle, mindfulness/meditation, meals, and medication. Those are the 5 M's. And so this video will remain on YouTube, so you can watch it again if you want to kind of share, or if you want to share it with someone. Make sure you follow and subscribe to my YouTube channel, because that is where all my information goes. And I'm here every Tuesday, 6 p.m. live. So with a different topic. And if there is a particular topic you want me to discuss, then please let me know. There has been some people have asked for different topics, and I will roll them out over the course of the year. And I'm also going to be bringing in some other experts to talk to you, because as much as I know and as smart as I think I am, there's always people out there who know more than I do. And so I will find them and bring them in, and you can ask them questions as well. Now I see some questions in the chat, so I'm going to get to those. I'm going to go back up. Let me see let's see if I can do that. I hope they didn't go away, because, let me see. Important ones for okay. On Facebook by default. Okay, so let's see where I'm going with this. Why wasn't it? It's not letting me. Oops. Okay. Well, it's making me put it out here. So I am a well-controlled type 2 diabetic. My current A1C is 5.0, and I take 5 milligrams of Mounjaro weekly. I asked my doctor about going up to 7.5 milligrams, as I would like to lose about 15 more pounds. Well, this is the thing, and I'm not sure how to take this out. So when it comes to your metabolic status, especially when you're diabetic, the main thing we look at is your A1C. Your A1C is corrected, so your type 2 diabetes is in remission. I mean, that you're still diabetic, and it's controlled with the medication, and you will need to be on that medication more than likely for the rest of your life to keep your diabetes controlled. Now, Wanting to lose 15 more pounds and needing to lose 15 more pounds are totally different things. So why is it that you want to lose 15 more pounds? What do you think those 15 pounds are going to do? A lot of people say, well, I want to lose 15 more pounds because I'm gaining weight around my middle. Well, this is what happens when you lose weight. It's not spot loss. So often if your waist is larger than the rest of your body and you lose 15 pounds, the rest of your waist is going to remain the biggest part of your body. It's just going to be smaller, and the rest of you is going to be smaller too. So the way to address that is to change your body composition, not change your weight. And the way to change your body composition is to build muscle. And so what you do to lose weight is to maximize your metabolism and your metabolic status through muscle. So that changes your status, and it changes your composition. And so, again, if there is some secondary reason that you want or need to lose 15 pounds, like your weight-bearing joints are aching because of that extra, or you have sleep apnea and it's still a problem, or you're just, it tips you over the BMI mark, which I don't really like to use, but if you're over 30 still, your BMI is over 30 or above 27 with your diabetes, then that 15 pounds may put you in a healthier range. But again, that's no guarantee it's going to be healthier. Sometimes when you lose that extra weight, you lose that extra weight in muscle, and you don't want to do that. So, and then sometimes when you gain muscle, you actually gain weight on the scale, but you lose size. And so, when you're treating a metabolic disease like type 2 diabetes, and you are so well controlled like you are, those 15 pounds become less important. But that is something you can discuss with your doctor, but there's other ways to get those 15 pounds off. Not saying that you can't go up on 7.5 to help, but it's only if that will help you in a healthy way. And there's a couple of unhealthy ways. One is that we stop eating altogether, which you don't want to do, because these are appetite suppressants to a certain degree, mainly because of central in the brain. So you don't want to stop eating. And so you want to maintain your health and your healthy appetite. So if everything is in a healthy range and everything is healthy, there's a reason why some doctors are hesitant to raise because you don't have anything broken. So there's nothing to fix. And sometimes those 15 pounds are not something that needs to be fixed. So that's just, that's my opinion. But I would need to know more information because it just really depends. There's too many nuances to know whether it's an accurate answer or not. So the next question is, my doctor is concerned about me getting low if I bump up to 5.7. What are your thoughts on this? Is diabetic dosing different from weight loss dosing? It is not different for Mounjaro. Diabetic dosing and medication and weight management medication for Mounjaro are exactly the same. It's only Wegovy and Ozempic that have different dosing. Going too low. If your doctor is concerned about going too low, that means you're teetering on normalcy right now, and they're really, again, needing to lose 15 pounds and wanting to lose 15 pounds, two totally different things. And managing your expectation of what those 15 pounds actually will do. Because if it, like I said, I hear it a lot. I want to lose weight because I still have love handles. I want to lose weight because I still have, saddlebags around my thighs. Losing weight's not going to change that. It will just make everything about you smaller, and those things will still be there. So, just being realistic. Now, there was a question from earlier, and I'm trying to get back to it. Okay, here it is. I started using an infrared sauna. I'm going to put this up here. I started using an infrared sauna. My CGM, which is continuous glucose monitor, shows high glucose during and after sauna use. Is this normal? Is this false alarm or high glucose release? It is not a false alarm, and it's not a bad thing necessarily. So what this is your glucose monitor is basically telling you what your liver is doing. A lot of what our blood sugars are what we eat or what our liver puts out. And so essentially when your body is under stress, and therefore it makes your body produce sugar. And so being in a sauna, your body just may not like it very much. But that doesn't mean it's a bad thing. It could mean that you actually need the glucose for something else. One of the reasons why I'm not a big fan of continuous glucose monitors, unless you are a diabetic on insulin, is because of this very reason. Most of us walk around with our blood sugars that flip-flop all day long, and we have no idea. And most of the time, it is not pathologic. It doesn't mean anything. It's just little blips that our body does to keep us in equilibrium. We don't need to know when it's happening. The only time that's really important for blood sugar, to know your blood sugars, is if they drop too low. One. The other time is if you're someone who is newly diagnosed with diabetes and you're trying to figure out what foods make your blood sugars shoot up. They become very helpful. But once you've learned what those foods are, you don't need to keep continuing to monitor. I actually am a diabetic, and this is just a personal story. It's not by no means scientific, but I am a type 2 diabetic. I am on Mounjaro. I used a continuous glucose monitor because I thought, it would be good for me to know what's making my blood sugars go up. All it did was wake me up in the middle of the night because my blood sugars got below a certain level, and the machine wouldn't let me adjust it. I was asymptomatic. I had no symptoms, so it didn't matter that my blood sugar was low. All it did was disrupt my sleep, so I stopped using it. And that's often what happens. We get false readings that are non-pathologic, and the only time it matters is if it's symptomatic. And if it's not symptomatic, then it really doesn't matter. However, if you're somebody who is in a weight management program, who is trying to lose weight, understanding that saunas that should help you relax, in your case, are doing the opposite, is making your blood sugars go up, which means your body immediately is going into fat-making mode. Because when your blood sugar is up, your body does one of two things, makes fuel or fat. And if you don't have enough muscle for it to use it for fuel, then you're going to make fat. And that's just the way the body works. All right, let me see if there's any more questions coming down. Oh, hello, Denise. How are you? Okay, Denise has a question. I had gastric bypass surgery. I'm just going to put it up here. I had gastric bypass surgery 14 hours ago. I'm assuming that 14 years ago. And gained 60 pounds back. Now on 5 milligrams of Zepbound for 2 years and maintaining. Is it likely I will need to take Zepbound as a lifelong med? Yes. And the reason is, the gastric bypass helped you lose, but it didn't go after the cause. Most people who gain weight and gain weight very easily, it's because of our metabolic status, not because we overeat. And it's our metabolic status that may make us overeat because it's our brain driving our appetite. So even when we have gastric bypass, it does not affect how our brain functions and therefore gain the weight back. That's why most people who have gastric bypass end up gaining it back, because the bypass did not go after the cause of the problem. Zepbound, however, is going after the cause of the problem. It's metabolic disruption. And so if it is Zepbound that is keeping the weight off, and mind you, that is a very low dose. So being on a low dose medication for the rest of your life to maintain a chronic disease is exactly what it's designed for. So I wish there was a way we could expand the definition of diabetes, because I think if people understood that when you use Zepbound, Wegovy, any of the other GLP-1s or GIP GLP-1s, and it results in weight loss, That means you're on the continuum, the same continuum as diabetes. That's why diabetic meds work. And so if you do nothing, absolutely nothing, there is a very high likelihood you will become diabetic. Any woman who's had diabetes in pregnancy, no matter what happens later, you have a 50% chance of becoming diabetic in your lifetime. And that's why pregnancy being a disruptor is why many times women have difficulty losing weight after being pregnant. But yes, you will probably need it for the rest of your life. You may not need that same dose. You may not need to take it every week, but you will probably need to take something. The only things that can take over from the medication is muscle and dropping cortisol. It's stress management or cortisol management. And the only thing I've seen in all my years who I've seen do both at the same time is Pilates. And that's not all the time, but it helps. So maybe you might have more muscle and then take less medication. It may mean instead of taking 5, you take 2.5, and instead of taking it once a week, you take it once every 2 weeks, but you'll probably need something unless something else takes its place. And it's most of us, or many of us, like I am a very brittle diabetic. It takes a lot for me to keep my diabetes under control. I don't have enough hours of the day to build enough muscle in order for me to maintain my metabolic status without medication. That's the genetic, cards I have. So, but I understand that. And like I said, these meds are designed to take lifelong. And so I will. Denise M24 says, I agree, I was pre-diabetic and that's why my doctor put me on Zepbound. Exactly. Zepbound, unfortunately, I wish we could use pre-diabetes as a diagnosis as prevention for diabetes. So what your doctor did, essentially, Denise, was prevent you from becoming a diabetic, which has also prevented you from all the complications of diabetes. And so it is absolutely a medication for that. Isabel says, I'm on Zepbound, and I have type 2 diabetes. And that is, if it works, it works. Ozempic is a wonderful medication. I was on it at one point. I switched to Mounjaro mainly because, and it's going to sound really silly, mainly because a drug rep came by and said, oh, this is a better medicine. So I started taking it instead of Ozempic. I do like it better because I don't have any of the side effects I had with Ozempic. But then for every person, it's different. My rule of thumb is, you want to get by with as little medication as you possibly can. If your A1C is 6.5, depending on how long you've been on the medication, Isabel, you're going to have to keep going up. 6.5 is not controlled diabetes. Now, I know that in medicine they say, oh, if you're under 7, you're controlled diabetic. I was trained with far stricter. Our goal was to get you to a normal A1C. Sorry, I said BMI. I meant A1C. Get you to a normal A1C. And a normal A1C is under 5.6. There is this thing where we don't want to see people over a certain age below 7 because we're worried about hypoglycemia. That is a real risk. However, if you're not on medication that drops your blood sugar, like a sulfonylurea or insulin, then it's not something you've got to worry about. But you'll have all the complications of diabetes unless you get below 5.6. And your body will continue to hold on to fat and will continue to take calories and turn it into fat instead of fuel until you're in the 5s. And so I treat diabetes a little more aggressively than many people. Where I trained, we treated it very aggressively, but I also trained in a metabolic center of excellence. And so that was how we did it. But it requires a lot of monitoring, it requires a lot of knowledge, and it requires a lot of care and follow-up. So, depending on where you started, 6.5 may be really, really good. But I can tell you, there's you could, and your age. I mean, that's up to you and your doctor. There may be other extenuating circumstances that I don't know. I can't say, but personally, 6.5 is too high for me. I'm not comfortable with it. For me, I was at 9 or 10, and now I'm at 5.2. So, and I'm 60. So, age makes a difference. I was first diagnosed when I was 35, I want to say, and I was so badly out of control. I was on insulin at one point. So, any other questions? Well, I try to keep this as short as possible because I know your time is valuable. If there are any more questions, now's the time to ask. If you think of questions later, you can write to me at help@drtoomer.com. I'm going to put that along the bottom so that help@drtoomer.com is where you can write to me with questions, with concerns, with if you want to request a consultation. I do consultations. Strategy and plan consultations. I kind of look at all your medications, look at all your labs. I can order labs, and then kind of create a plan for you to kind of, well, not even to actually get you from point A to point B and to stay healthy for the rest of your life. It's not enough to just do, it's not enough to just get someone healthy now. You want to maintain your health for the rest of your life. So. Nadine. Hi, Nadine. Thank you for coming. And I saw some others that I want to say hi to. Hi, Patsy. Hi, Denise. Hi, Maisha. Thank you for coming. And Chrysalis with Becky, Robert, Ed. I'm not sure what name, but I'm glad you're here. Thank you for coming. So I'll see you next Tuesday. If there are no more questions, and I will see you next Tuesday on the Dr. TOOMER Talks Show. And again, write to me if you have questions. Write to me if you have request a consultation, or follow me and subscribe to my YouTube channel. Hope to see you next week. Bye.